Okay, so we are going to talk about shoulder osteoarthritis. Typical epidemiology, you're going to see people over 60 years old more prone to this. Women are greater than men, and then past history of glenohumeral dislocations, AC separations, fractures, sprains, anything to the shoulder, this will give them a greater risk. Typical subjective, patient will complain of crepitus or cracking or creaking or squeaking, whatever you want to call it, in the shoulder. They're definitely gonna have trouble sleeping due to just discomfort. Anytime they roll onto it, it's gonna hurt. Trouble performing ADLs because of decreased range of motion. As you see in my objective, range of motion is going to be very, very decreased, very resisted. Pain location, it's going to be for the GH joint, it'll be kind of the posterior aspect of that joint, and then the AC joint, you'll see more on the superior portion of the AC joint. Okay, Mike, so I read your income papers. Tell me about a little bit what's going on.
Yeah, so I play a lot of pickleball. I'm in the NPA, National Pickleball Association, and we've been just getting after it. I started getting this pain back here in the back of my shoulder the past few weeks or so, and it just has not been going away.
Okay, tell me a little more about that pain. So what's that? What kind of brings it on?
Usually when I go for a spike, I got a pretty nice spike. So when I get kind of close to the net and go overhand like that, that kind of hurts. When I'm resting, it doesn't really hurt too much if I warm it up pretty nicely. But yeah.
Okay. How severe would you say this pain is? If I were to say 0 is no pain and 10 is let's go to the hospital, worst pain you can ever imagine.
If I get really worked up in a game or a couple games, then probably like a 4.
Okay. And then how long, what is it? Let's just say on average, what would you say it is?
It usually feels like a little bit of something, so probably like a 1, but
Okay.
It does get down to a 0.
Okay, so when you get up to a 4,
Mhm.
how long does it take you to get back down to a 1 or a 0?
Probably a couple hours.
Okay.
Sometimes after games and stuff, I'll ice it, and that starts to go down after like probably 20-30 minutes.
Okay, good. So icing helps it.
Yeah.
Okay, nice. Tell me anything else that's giving you trouble with?
Not really. I mean, if I'm trying to like pick up my grandkids and play with them and stuff, that'll bother me some. Like I said, in the morning, it'll take a while to get warmed up, and then just like trying to get comfortable while sleeping is tough sometimes.
Okay, so sleeping's an issue.
Yeah.
Okay, tell me a little bit more about that.
If I just roll onto it, or I don't know, it just wakes me up a lot.
Wakes you up a lot. Okay,
Yeah.
so when you wake up, how hard is it for you to go back to sleep?
Probably like half hour.
Okay, and that is that due to like changing positions, or is that just it's a constant pain the whole time?
It's not too constant. Usually if I roll to the other side
Okay.
and get away from it, it'll go away eventually.
Okay.
Yeah.
And I think I noticed you rubbing kind of like the back of your shoulder earlier. Is that where your pain is?
Yeah.
Okay.
Mostly.
All right. So trouble overhead. I heard that right. Do you hear anything when that's going on?
Yeah, sometimes it like clicks a little bit, kind of feels like there's almost like a grind.
Okay.
Yeah, like things are just kind of running together.
Okay. Is that grindful? Is that painful?
It's definitely uncomfortable.
Okay.
Not always painful.
Okay. Tell me, have you ever had any other injuries to the shoulder?
Yeah, when I was playing football when I was little, I dislocated it
Okay.
a few times.
Okay. And just because we're on camera, can you state your age for me?
75.
Okay.
I think.
All right.
Yeah.
You don't look a day over 24.
Appreciate it.
Yeah.
Get that a lot.
How about any numbness, tingling going down the arm?
No.
Okay. You ever had any neck issues?
Mm.
Okay. Does your shoulder pain ever come on with neck motions, head motions?
No.
Okay.
Not that I've noticed.
Any problem bowel or bladder?
No.
you said night pain. Any unexpected weight loss anytime recently? Okay, weight gain, anything? COVID counts don't count.
Yeah.
Woo! We're all there, pal. Do you have any questions for me?
Not really.
Okay.
Hopefully we can get it figured out.
Yeah, let's get that figured out, all right? So this is a typical pain diagram that you'll see. So typical objective findings. As you'll see when I go through with Mike, they're painful with both passive range of motion and active range of motion, and there'll be crepitus with both, and you'll feel it, you'll hear it. There'll be internal rotation will be probably the most affected just due to the posterior capsule and the thickening of that. And then for Sperling's should be negative, neurotension testing should be negative. Those are both kind of unrelated to the OA. And then palpation of the joint is actually not painful. All right. So I kind of have an idea what's going on, but I wanted to see you move first. So I know you said you have no neck issues, but just play along here. I want you to look up at the sky.
Okay.
Look down. Bring your left ear to your left shoulder. Bring your right ear to your right shoulder. All right, I want you to look at the far wall to your left and look at me. Any of those change your symptoms whatsoever? Okay. All right, I want you to, I'm just gonna kind of shift your head around, all right? So I'm gonna have you here, here, and here.
Okay.
Does that change anything?
No.
Okay, I'm gonna have a little pressure. Change anything?
No.
Okay, same thing. We're gonna do the same thing this way. So that. Does this change anything?
No.
Good. Okay. Now I want to see this thing move. So first left arm, I want you to go up. Okay. And to the side. Good. I want you to go in. Cross your body. Good. Out. Okay. That changing your symptoms?
No.
Okay. Same with the right. Alright? So we're gonna go up first. Oh, that thing's clicking.
Yeah.
Alright, let's go back down. How does that feel?
Tough.
Tough?
Yeah.
What's that pain at?
Probably like a 3.
Okay. Is it back down?
Yeah.
Okay.
Kind of like a 1.
Let's go down to the side. Go out to the side. Okay.
Yeah.
Crepitus again.
Yeah.
Any pain?
No.
Okay.
I think it creaks like the flies.
Yeah, it does creak. Alright, let's go across here. Any pain with that?
A little bit.
A little bit of pain?
Not
Okay,
as
let's go
much.
out.
Yeah.
Okay.
Yeah.
A little bit of creaking, but not too bad.
Yeah.
How's that?
It's okay.
Okay. Go like you're showering. I'm gonna have you stand up real quick so the camera can't see your face. Oh, we can still see you. We're gonna go up the back like this, or reach back as far as we can. Ooh, just like you're showering, all right?
Yeah.
Oh, okay. So yeah, you're just to the lateral buttocks. All right, we're gonna go back overhead like this, like you're scratching your back.
Okay. Yeah.
Okay. Yeah, that's limited to. Okay. Not as bad as the internal rotation, but it's still pretty bad, right? Okay. I'm gonna have you lie down. I'm gonna put your head down this way. Good. Good. Yeah, a nice fancy table here.
Does.
All right. I'm gonna just take you in the range, okay?
Yeah.
I'm gonna do the same thing. Let me know.
Yeah.
Oh, geez, that thing's clicking.
Yeah.
All right. Pain?
A little bit.
Okay. We're gonna go up this way. Go.
Yeah.
Oh, okay. That thing's really clicking. All right.
That's tough.
Okay. We're gonna stay right here. We're gonna do internal.
Mm-hmm.
Oh, jeez, that is clicking. All right. Going back out. Okay, that's clicking too. Yeah, you're clicking a lot today. You're making all kinds of farm animal noises.
I know.
How's their pain?
It's probably back down to like a 1 or 2.
Okay.
Bonus there.
All right, I'm gonna try another test on you. We're gonna just test out kind of your neural system here, right?
Yeah.
So I'm gonna go back here. I'm gonna just relax. Let me take care of it. All right. Okay. And because you're such a good patient, can you bring your head back to the middle? Good. How's that?
Nothing.
Nothing? Okay, good. That didn't affect your pain at all? Okay, good. All right, I'm gonna have you sit back up for me, if you don't mind. All right, I wanna see how you spike the ball.
Alright.
So, to the best of your ability, I know it's gonna be a little painful,
Mm-hmm.
but I want to, and you can do it sitting so the camera can see you,
Okay.
but I want you to act like you're gonna spike a ball right now.
Okay.
You're playing David. You got to beat him. All right.
I will.
All right.
Okay.
There.
Yeah.
That's it.
Yeah. That's
Okay.
enough.
Do you usually come up a little higher?
I can usually get it to.
Can you?
Like arm
Can you do it with your left?
Yeah.
All right. Good.
Come on here. Get
All
it to about here.
Good.
Yeah.
All right. I'm just gonna feel it real quick. You said your pain's back here, right?
Yeah.
Okay. I'm just gonna feel it. Does this hurt at all?
No.
Okay. Nothing?
Mm-mm.
Okay. Last one. I'll take this from you. I'm going to take your arm. You just relax. You let me take do the work, okay?
Alright.
Okay, I'm gonna come up. Any pain?
No.
Okay. Any pain?
No.
Okay. Alright. Alrighty. So the key diagnostic feature we have right now is just a simple radiograph. You'll see a decreased joint space, or you'll see abnormalities to the humeral head, like this sad face right here. And then mechanisms, symptoms. What patients will typically say, if they're educated at all, is that it's bone on bone, and it kind of gives PTs a laugh, I've heard. The joint spaces themselves are actually highly innervated, and so the nerve endings, when the cartilage kind of generates, become more active and they get excited easier. And then also there's evidence of hyperalgesia and abnormal central processing, especially as this goes longer on, becomes more chronic. This becomes more common. And then just like most pain, there's going to be cytokine release in the area. So what do? We treat it. PT is actually the best way to deal with this. Shoulder surgery, depending on the patient, can be iffy. So how do we do that? We take care of the pain. We gain range of motion. We strengthen the shoulder girdle, and then take into account what they want to do. So if they want to play pickleball, we're going to work on overhead motion. If they want to play golf, we're going to work on that. Stuff of the sort. Just kind of take into account what they want to do, and then advise on some lifestyle changes and then some activity modifications and how we can work on that together.